Hi guys, my name is Sam and I'm just going to be going over a brief overview of burns and pressure ulcers and what we can do as far as promotion and prevention for them. So basic burns is just characterized by the inflammatory response of your body when it has exposure to different things. Burns can be caused by chemical sources, radiation, wet heat, electricity, heated objects, dry heat, friction, some things that you would experience probably in your everyday lives, ovens, stove tops, some caustic, even cleaning supplies can cause burns. The major thing with burns is their staging. So first degree is going to be burns that are more minor. Think like your sunburns. It's like when your skin kind of turns this color and pink. It can be kind of painful, but they usually kind of resolve on your own with a little tender care. We then go down to our second degree burns, which is a little bit more serious because we're starting to involve that second layer of skin, the dermis. You can have pain, swelling, and blistering with your second degree burns. The most important thing to remember with our second degree burns is to not pop the blister. We want to leave them alone. We want to keep them covered. We want to make sure that we're not playing with any of those because we can get infection from popping those blisters. And then of course, major problems develop when we get down to that third degree. And that's because it involves kind of all of those layers of your skin. So you're going to have your dermis, your epidermis, and the below layers involved in these burns. These burns kind of look like this. And when we get down to that, that's when you're going to need more medical intervention to keep infection rates down, to make sure that we're staying hydrated and helping that burn heal. So some of the preventative things that you can do, one of the big ones is to wear sunscreen. You want to make sure that you're not going out in the major parts of the day when the sun exposure is at its most virulent, so like kind of that noon hour. There's an old saying, it's only mad dogs and Englishmen go out in the noonday sun, and that's because that's when it's most focused. So we want to make sure that we are staying that. If you are going out, you want to make sure you're wearing long sleeves, pants, maybe a sun hat to keep that sun exposure down. Basic safety rules around the kitchen, make sure that we turn our stovetops off, that we're watching our kiddos when they're around heated sources. Here in Montana, we do a lot of camping, so we want to make sure that we're watching ourselves around fires and any open flame as well. Make sure that you're wearing appropriate gear when you're dealing with chemicals in any sense, whether that's cleaning your kitchen or out there in the world. And we can kind of hopefully avoid major third degree burns, and with proper prevention, we can even prevent those first degree burns. So I'll just touch on pressure ulcers. These are a huge risk for our older individuals, but they can really happen to anybody. And the thing with pressure ulcers is they can manifest in about 3 to 4 hours. So what they are is when your soft tissue gets compressed, and if it's for an extended period of time, it can kind of rub and open an ulcer. So these also have staging. Stage 1 is just a little red area. Stage 2, it starts to open up, so it kind of looks like an open blister. And stage 3, we're going to get into those like full thickness. It's down in our layers of the epidermis and dermis, like we were talking with the burns. And then stage 4 is fully open, and you can actually see muscle and down to the bone with these guys. The most effective people, if you have like an injury where you're immobilized and you can't move around, you're not drinking enough water, your skin's kind of already in that damaged area. And so if we're having major surgeries, or we're going to be laid up, or we're sick, it's really important to make sure that you're moving your skin, we're patting bony areas, so that we don't get any friction to create that rubbing. The major thing with these two is when you're sick or you're hurt or immobilized for a long period of time, make sure you're drinking lots of water and you have proper nutrition, and we can kind of keep these down. If you have an older relative that's going in for surgery, or at the nursing home or wherever you're visiting them, it might be a good idea to kind of check their skin out and just make sure that there's nothing that looks like it needs to be furtherly inspected. So that was pressure ulcers and burns. Hopefully you enjoyed my presentation, and thank you guys very much.
Hi, my name is Megan Loomis, and I'm going to be talking today about skin cancer. So we all know one of the biggest causes of skin cancer is sunlight and things like tanning beds. It's from UV exposure or UV radiation exposure. But there's a few other causes that can lead to skin cancer. So repeated X-ray exposure, scars from burns and illnesses, and then occupational exposures to certain chemicals. So we need to be aware of things that could alter or damage our skin in our everyday life and try to protect ourselves from those things. One thing that helps protect us is melanin. It's a pigment in our skin that gives us dark spots like freckles and moles, or even more color that gives people a darker skin tone that helps protect us from UV damage. So that means that people that are light-skinned or fair-haired and light eye-colored have a higher risk of developing skin cancer. However, just because somebody has a darker skin tone doesn't mean they're exempt. They still have a risk for skin cancer. So ways we can protect ourselves. We want to make sure that we're using sunscreen when we go outside, that we're avoiding high sun times like from 10 a.m. to 4 p.m., that we're in the shade when we happen to be outside, that we can use UV protecting clothing, and that use a SPF 15 or higher on a daily basis. So even when you're going outside just to walk to your car, you're being exposed to the sun, so using moisturizers that have an SPF in them is very helpful. And we also want to look for those other causes. So if you are repeatedly injuring a tissue site, that could be a spot for skin cancer. We want to make sure that we're getting yearly screenings by going to our dermatologist and having skin checks. And then a simple tool here is the ABCDE of skin cancer screening. So we want to look at our skin on a regular basis as well and look for signs of any changing to our freckles or moles or any just spots that seem a little suspicious on our skin. So when you look at ABCDE, you want to look at, like, your freckle, is it asymmetrical? Is the border irregular? Is it changing in color or variation? Is it a big diameter? Is it 6 millimeters or bigger? And then is it evolving? So any of these things are kind of a clue that we should go in and get it further checked out. They can do some simple procedures to just determine if it's something that is a concern, like doing a simple skin biopsy and sending it off to pathology to find out what kind of skin cancer it is. And then over here, I've just got some of the common skin cancers that you see. All right, so we've got actinic keratosis at the top here. There's two pictures. It is a pre-malignant skin lesion seen in older white populations. They're a very common lesion. It's usually denoted by the flaky white skin and the or like a scale, carotenotic scale. And we've got basal cell carcinoma. This arises from the epidermal basal cells. It's a very common but least deadly cancer, and it's seen in middle-aged older adults. Let's see, these tend to be ulcerative with pearly borders, so you kind of see the whites in the picture ends up being the edge of the basal cell carcinoma. Then we have squamous cell carcinoma. It's a malignant neoplasm of keratinizing epidermal cells. So these occur in areas of our body that are heavily exposed to sun, and they tend to have these really dark borders. And malignant melanoma, so this arises from the melanocytes that protect our skin. They're very, very dark because they contain all that pigment in them. This is a major cause of skin cancer death. And then we've got atypical dysplastic nevus. So these tend to be just irregular freckles or an irregular patterned mole, but it does put patients at an increased risk for melanoma. So these can change into our malignant melanoma. All right. I don't know if I should say anything else.
Hey everyone, my name is Sarah Ann, and we are going to talk about MRSA and oral herpes. So MRSA is also called methicillin-resistant Staphylococcus aureus infection, and this infection is caused by the Staphylococcus bacteria, which is resistant to several different antibiotics. These bacteria naturally live in our nose and on our skin, and generally don't cause any harm. However, when this bacteria begins to multiply uncontrollably, a MRSA infection occurs. So, MRSA infections typically occur when there's a cut or break in the skin. It is very contagious and can be spread through direct contact with a person who has had the infection. Hospital-acquired MRSA is associated with infections that are contracted in medical facilities such as hospitals or nursing homes. You get this type of MRSA infection through direct contact with an infected wound or contaminated hands like the healthcare workers if they don't wash their hands between patients. You can also get this infection through contaminated linens or poorly sanitized surgical instruments. Hospital-acquired MRSA can cause severe problems such as blood infections and pneumonia. Also, there's community-acquired MRSA, which is associated with infections transmitted through close personal contact with a person who has been infected or through direct contact with an infected wound. This type of MRSA infection may also develop because of poor hygiene, such as infrequent or improper hand hygiene. In order to diagnose MRSA, you need to go to the doctor, have your medical assessment and physical, and to confirm MRSA, they either do it through a wound culture, sputum culture, urine culture, or blood culture. And so treatment, depending on if you have hospital-acquired MRSA or community-acquired MRSA, will depend on your antibiotics. So with hospital-acquired MRSA, you're gonna have long-term IV antibiotics because usually with your hospital-acquired MRSA, it's going to be a more severe spread and quicker. Whereas your community-acquired MRSA is treated with oral antibiotics. Both of these treatments are going to last between 4 to 6 weeks, depending on how your body reacts and how the actual MRSA reacts to the antibiotics. And so prevention of hospital-acquired MRSA, most of our patients are going to be put on some kind of contact precaution or isolation. And also hospital personnel is going to be following a more strict hand washing procedure. Also hospital staff and visitors will be required to wear protective garments, gloves, and the linens for the patient will be frequently disinfected and changed. Community-acquired MRSA, to prevent, you need to wash your hands and use hand sanitizer when you're not around sober water. You need to keep your wounds covered at all times and don't share personal items such as towels, sheets, razors, or athletic equipment. Wash your bedding and towels in hot water with extra bleach and dry everything on high heat. And so then the next one that we're going to talk about is oral herpes. So oral herpes is cold sores, and they're red fluid-filled blisters that form near or around the face, but they can also be on the fingers or in the mouth, as well as on the genitals. And so they can also last usually 2 weeks or longer. And so what causes cold sores is the herpes simplex virus. There are two types. There's herpes simplex type 1 and herpes simplex type 2. And so herpes simplex type 1 is usually associated with oral herpes virus or cold sores, and then you have herpes simplex 2, which usually causes your genital herpes. Please be aware that both of them can cause both oral and genital, depending on where they are located. So visible cold sores are contagious, but they may also be spread when you don't see any visible sores. And you can get the herpes simplex virus by coming into contact with infected individuals by kissing, sharing makeup, foods and drinks, toothbrushes, razors, and oral sex. Once you get the herpes simplex virus, it cannot be cured, but it can be managed. According to Mayo Clinic, 90% of all adults test positive for at least, or test positive for herpes simplex virus type 1, which is your oral. There are 5 stages to your cold sore. So the first stage, before you even get, the open wound or sore, you're gonna feel tingling, itching. And it's about 24 hours before the blisters erupt. Then stage 2 is when the fluid-filled blisters start to appear, and stage 3 is when they burst, and then they form the painful sores. And stage 4 is where the sores will start to dry out and crust over, and that's when you're going to get your itching and cracking. And stage 5 is when the scab falls off and the sore heals. Again, even though that sore is healed, you can still pass this on. So other common risk factors for reactivation, since there's no cure, okay, is stress, weakened immune systems, such as infection, fever, cold, sun exposure, so if you're outside, and then in women, menstruation. And so treatment, again, there's no cure for cold sores, but they can be managed. And usually you're gonna manage them with antiviral ointments and such as penna clover. And then there's an over-the-counter, which is called Abreva, which many people use. And then antiviral oral medications such as acyclovir and valciclovir, but they're only available through your doctor. And then symptom management, you're gonna apply, ice, and then lysine supplements have been associated with less frequent outbreaks for some people. Aloe vera to help with itching and crusting. Petroleum jelly, again, itching and crusting. And then witch hazel helps to dry out the actual sore. And so to prevent these, outbreaks from occurring, you want to use like zinc and practice stress management, but prevention to stop the spread is to wash your hands, avoid skin contact with others, and then don't share items that you touch your mouth or an open sore during an outbreak, like your lip balm, your foods, or utensils, and then avoid, kissing or any kind of oral sex. So that is MRSA and oral herpes in a wrap. Thank you.
Hi, my name is Abby, and I'm going to be talking about acne. Acne is an inflammatory disorder of the sebaceous glands. Sebaceous glands secrete an oily substance called sebum into the hair follicles, and acne happens when those hair follicles get clogged up with bacteria, dead skin cells, or oil. Most common in teenagers, but can persist into adulthood. So what does acne look like? You can have those blackheads, whiteheads, or you can have papules or pustules, or cysts and nodules. And so the mild would be like the blackheads and whiteheads, and it gets more severe towards like the cysts. Tips from the American Academy of Dermatology: to wash your face in the morning when you wake up, before you go to bed, and after working out and getting sweat on the face. Do not scrub your face, it may irritate the skin and worsen the breakout. Do not be like touching your face. Do not pick or pop at acne, it may spread the bacteria to the other pores. Acne can be caused by bacteria, clogged pores, oily skin, and inflammation. Use a product with benzoyl peroxide for acne caused by bacteria. Use a product with retinoids for acne caused by clogged pores and oil. And you can also use salicylic acid for acne caused by inflammation and clogged pores. And so when you're trying a certain treatment, they say to try it for 4 to 6 weeks to see if there's any improvement. Use a lotion, face mask, and makeup that won't clog your pores. Look for products that say non-comedogenic and oil-free. Wash your bed sheets, pillowcases, and hats frequently, even 2 to 3 times a week, because bacteria and dirt can build up on those. Wash your makeup brushes and sponges as well. going to the dermatologist for severe acne. Some treatments may include antibiotics, birth control pills, oral or topical medications, laser therapy, chemical peels, or some draining procedures. One medication that may be prescribed is called isotretinoin, or most commonly known as Accutane. It is a form of vitamin A used to treat severe cystic acne. So for females, to get this prescription, they must have 2 negative pregnancy tests to obtain their first prescription. They must see the dermatologist every 30 days and take a pregnancy test for the next month's prescription. And so this is included in a contract that they must sign called iPledge. And the treatment for this is usually 4 to 5 months at a time. Isotretinoin it has these strict guidelines for women because if taken while pregnant, it may cause miscarriage, severe birth defects, or premature birth. Females must pledge to use 2 forms of birth control, such as a hormonal combination birth control pill that doesn't have an interaction with this medication, male condoms, an IUD, hormonal shots, or transdermal hormone patches. Female condoms, withdrawal, and natural family planning does not work as either of the 2 forms of acceptable birth control. Males also have to sign the iPledge. However, there has been no evidence that this medication affects sperm. Common side effects of taking this Accutane is temporary night blindness, temporary thinning hair, and muscle pain that goes away after discontinuing the medication. Also may cause dry lips, dry eyes, dry mouth, nosebleeds, and skin sensitivity. Do not tan on this medication. Wear sunscreens with an SPF of 30 or more. Cover up outside, wear long sleeves and a hat. Do not wax your skin while taking this medication up to 6 months after discontinuing treatment. This is because waxing may cause scarring. Do not donate blood during treatment and up to 1 month after discontinuing this medication. If you have any questions, please visit aad.org. That's the American Association of Dermatology. And if you want some more information about the iPledge program, it's ipledgeprogram.com. Thank you.